Do you see with me now?
Yeah,
Yes,
I see
yes,
now.
you are seeing.
Okay. So I will do it
Can
very
magnify.
fast.
Can magnify it.
Mhm.
Full screen, Dr. Yasser.
Full
Yeah.
screen, like this.
Yeah, yeah.
Yes,
It's okay
Yeah.
now?
Yes.
yes, it's
Now
okay.
it's okay. Now,
Okay.
go ahead.
So the problem in refractive surgery is the ectasia, so the post-LASIK ectasia, and there are some cases of normal topography with post-LASIK ectasia. So that means that there is a problem in topography that do not distinguish or do not diagnose very early cases of stages of keratoconus. So the epithelium, the role of epithelium is to fill the gaps and to try to smoothen the shape of the cornea. So as I mentioned, when we explore with topography, it's like we take picture from the hair. When we measure the epithelium, we can know the really height of this person and to measure it from the skin head. Like this nature. When we measure it with a topography, we measure from here. But when you do epithelial mapping, you measure also the stroma, and you can differentiate between topography and the OCT that give you the real shape of the stroma. So, and we know that the behavior of the epithelium is predictable. So we have the thinning in the peaks of the cones. So we have in every keratocone we have this image of donuts. So the same thing. We have thinning here, and we have thickening around. And as the epithelium is trying to hide any irregularity in the stroma, so we can sometimes have the same topography, but the shape of the stroma is different. So in every keratoconus, we have this image. And now it's a criteria of diagnosis of keratoconus. So this is normal epithelial mapping. It is homogeneous, but there is a difference between the superior part and the inferior because of the eyelid. But in keratoconus, we have every time we have this thinning and thickening over around. This is the same thing, the behavior of the epithelium in histology. So in this case, you have a normal axial map, but if you see in the epithelial map, you will see a thinning in the center, and it means that it is maybe, this is my my daughter. So in this case, you have a normal shape of the cornea, normal topography, even if we have a thin part, a thin stroma, a thin cornea. But as we have this thinning in the center of the map, epithelial mapping, it means that maybe there is an early keratoconus, and this is maybe a false negative. And in this case, we should avoid LASIK. This is the opposite case, that we have an asymmetry, but you have a thickening in the steepest point. So that means that there is not a keratoconus. If it was keratoconus, we will have a thinning in the peak of or in the steepest point. So in this case, we can go for keratorefractive procedure for PRK, which is good case for PRK. The epithelial mapping can be used also to monitor the progression of keratoconus. So we can measure the thinnest point of the thinnest point of the epithelium and the thickest one to compare the difference, and the difference will become higher when the keratoconus is progressing. Like in this case, we have a small thinning in early keratoconus. Moderate keratoconus, you have more thinning, and in this advanced keratoconus, we have more and more thinning, and the difference, I call it the delta. It means the difference between the thinnest point and the thickest point of the epithelial mapping, and this difference will be higher in the progression of keratoconus, and we can use it to monitor the progression. And we have some here. I present a case of very thick epithelium in keratoconus. So it means that when we do cross-linking, when we measure only the total pachymetry, we don't know how many stroma we have. If we have 65 of epithelium, so the calculation of the thickness of the stroma will be wrong to do cross-linking and to choose the right protocol. And we have the epithelial mapping shows that the thickness of the epithelium is different from a person to another. So when we do transepithelial PRK or we do any other procedure, we should know the epithelial thickness of the patient. Here we have around 55, here 43, here more than 65. And to conclude, we have to use epithelial mapping in all in the diagnosis of keratoconus, in the screening, in to monitor the progression, refractive surgery, and before cross-linking. So that was my presentation. Thank you.
Nice.
Thank
nice
you very much. Thank you, and very, very good and nice presentation, Dr. Yasser.
Thank you.
Dr. Mahdi.
Nice.
Do you have any questions or any points about that؟
لا.
احنا اتشرفنا دكتور ياسر بوجودك معانا النهارده.
شكرا جزيلا. انا اتشرفت.
ربنا يخليك.
دكتور ياسر اهلا بيك.
شكرا جزيلا.
ربنا يخليك.
الله يحميكم ويحمينا من هذا الوباء.
امين
جميعا ان شاء الله
والبشريه
كلها ان شاء الله.
اوكي ربنا يخليك.
يا رب ان شاء الله ان شاء الله.
all thank you very much. Have a very good night. And
شكرا حسام.
Please be ready for the coming meeting. To be
سعيد اشوفك ايهاب.
اوكي. وانا اسعد يا فندم ربنا يخليك. السلام عليكم.
الله يكرمك.
تصبحون على خير. مع السلامه.